To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Today we're going to talk about chronic vein disease. To talk us through that is Dr. Pat Brennan from Surgical Associates in Neenah. Doctor, welcome. I think we should set the stage. What is chronic vein disease?
So chronic vein disease covers a very wide spectrum of disease signs and symptoms. Generally, we think of it as resulting from high pressure in the veins, the vessels that bring the blood back to the heart from the tissues. And that can lead from anything to spider veins, varicose veins, swelling, and other more severe conditions.
All right, so what would happen if we don't get what are the risk factors, I guess?
So initially, the patients who tend to see me tend to be older patients. Women tend to have more issues with the varicose veins. Obesity is a big factor. Family history is a really big one. That's always a factor that if both parents have disease, it's almost a certainty that the child will have the disease as well. So.
Yeah, mom and dad have it, you're in line. All right, so what are some other signs that we should look for?
So the throbbing, aching pain is a common one. The symptoms of that, it's important to differentiate that from other conditions as well. The varicose veins are the obvious one, dilated, twisty veins that kind of protrude from the surface. Spider veins are the smaller ones that are about less than a millimeter. Swelling and skin discoloration are another common sign of the disease as well.
And I would suppose a lot of that would relate into pain too. I mean,
exactly.
Uncomfortable. All right.
Yeah.
So if we see these signs that we have, what does management of the symptoms look like?
So initially, there's a conservative type treatment, which would be elevation of the legs, taking away the force of gravity. Compression stockings is a very common one. And exercise seems to help as well in that situation. If those fail, and after a trial of the conservative therapy, then there's actual interventions such as ablation of the vein, a closure of that vein with a catheter, or actually physical removal of the veins called a phlebectomy, where we make small incisions and we remove more of the end branches.
And is that something that's just done like in the office, inpatient visit, or is it a full-blown surgery?
There's different options. For more of the minor veins and the ablation, that could often be done in the office. So patients have different levels of anxiety with procedures, so we do always offer the operating room as an option with anesthesia, and especially for people with more severe disease, generally the operating room is a better option.
Sure. All right, so let's just recap chronic vein disease symptoms. Let's go through that one more time so
Sure.
people know.
So varicose veins are the most common, spider veins, leg swelling, skin discoloration, and the most severe would be ulceration of the skin.
And if anybody is noticing that, come see you and we can get them taken care of. All right, doctor, well, thanks so much for walking us through chronic vein disease, and we want to thank you for watching To Your Health.
The preceding was a paid advertisement.